In April last year, one of Johannesburg's biggest hospitals, the Maxeke Academic Hospital, went up in flames. Today marks exactly a year since the fire broke out in parts of the hospital, and yet the facility is nowhere near full functionality. For more on this, we are joined by the Head of Internal Medicine, Professor Adam Mahomed. Professor, very good evening. Thank you for speaking to us. You penned an open letter to President Cyril Ramaphosa. Did you get a response?
Thank you, Hugo, and good evening to your listeners. And I appreciate you keeping the focus on Charlotte Maxeke and the healthcare of Gauteng. And in essence, the answer is no. Not really anything of substance from whoever I addressed that letter to. So 1 year later, we're still talking and we're still getting nothing done. A lot of lip service and media publicity. That's about it.
Are you a frustrated man? Are the people that you work with at the hospital frustrated?
You know, you hit the nail on the head. Just on Thursday, I had 4 senior members of my staff who were phoning me to say they are on the verge, 2% to resign because they are tired. They're tired of fire, COVID, parking, bureaucracy, poor leadership across Gauteng. And the sadness is it's just getting worse. It's actually not getting better, no matter what you hear from the government officials. It's sad and it's inappropriate and it's getting worse, not just for Charlotte, for the entire Gauteng. Charlotte is a representation of Gauteng health, and we are failing. Barra is under immense pressure. Helen Joseph is under immense pressure. And who is suffering? The patients. And I only hear lies, deception, and dishonesty.
So maybe the president was too busy to report back on that letter that you wrote him. But Gauteng Premier David Makhura came to reassure the people of his province when the fire happened. And he said it's not an easy decision that we had to make, but within 7 days, we are confident that the hospital services will be resumed. It is 12 months since. Have you had a conversation with him?
It is true. Hospital services have resumed, but we are running at reduced capacity. We're not doing what we should be doing. We are a tertiary hospital. We do complex medical care, complex surgery, and we do complex obstetrics and gynae. We take high-risk pediatric cases. We're not a regional hospital. We're not a district hospital. And to say that the service in Gauteng is running smoothly is a shock and a lie. The healthcare users, 40 beds are gone. Helen Joseph, Baragwanath Hospital and other hospitals are not even coping with that subsector of population, which hasn't been addressed for many years, even before the fire. So you've had the Department of Health that has come in. You've had Development Bank of South Africa that has been involved. And if it was not for charity organizations like Solidarity and now Gift of the Givers, I think we would be in a worse off place than what we are currently in. It's really because of these organizations that we're sort of getting something going. But up to date, there is nothing of substance from Department of Infrastructure and Development, Department of Health, Gauteng Department of Health. And I'm talking of substance, not lip service. How many contractors are on site that are paid by the government? I want to know that. Hugo, did you get the report of the structural assessment of the part of the building that was damaged? The answer is no. Did we get the forensic audit of the fire 1 year later? 1 year. The answer is no. And I can go on. Those officials that were found guilty of whatever last year from Department of Health, Department of Infrastructure and Development, we have heard nothing. There's no accountability. There's no responsibility. But bureaucracy and red tape at my hospital in Gauteng, I think that's what we're very good at. Creating unnecessary work and creating paperwork.
Now, the other thing that's come up from reports that we've seen is that you've cited that poor workmanship. So when some work has been done, it's been substandard.
I don't know if it's substandard. I think there is, I can't explain it. None of us can explain it. But there's constant theft and vandalism and damage to whatever is being fixed up. The companies and engineers that Solidarity and that have been involved, it has been excellent. But can you imagine copper piping up to the value of 30 million rands gone? Electrical cables of over 500 meters being stolen. And even in the last month to date, we've had damage to computers of CT scanners. And If I were to put something in perspective, Hugo, it's not just the fire that we're talking about. We don't have a fully functional radiology department with working scanners. We have 2 condemned CT scanners working. So even while we're servicing patients, it's with our hands tied behind our back. Again, we must wait for a tender issue and all of this here, while the entire Gauteng health system is crumbling. We don't have proper CT scans to service that what we have now. So we're sending our patients elsewhere again. Again, we're burdening other hospitals that are already overwhelmed. Staff morale is low, lots of resignations, and it's impacting Charlotte Maxeke, teaching, education, and not just doctors. It's affecting nurses, healthcare workers. The dental school that's part of Charlotte Maxeke is also under immense pressure. And we are going to set back our country at least 5 years. And I would like to see 2023 we get finished with the hospital. But right now, what are we doing? I don't see anything. Maybe things are happening in the dark, and now really in the dark, but I can't see anything. I'm not optimistic at all.
Professor, put into perspective for us where the hospital is in terms of operation versus where it was before the fire.
So you're looking at, we're probably running around 60 to 70% of our capacity. But what we're not realizing is if you were to look at specific subsections of our hospital where we are the main service providers for Southern Gauteng, for example, cardiothoracic surgery, the entire proper cardiothoracic ICU ward is shut down. So it's being used and shared in a different venue in Charlotte Maxeke. Same thing goes for neurosurgery. 40 psychiatric beds, 0. So I think when people put out data that we're running around 70 to 80% of our capacity, it's not a true reflection. When you could actually say cardiothoracic, 20% or 30%, psychiatry, 0%, pulmonology ward, 0%, infectious diseases ward, 0%. Let's put things in the real perspective. Our casualty to date is still not up and running. Deadline, December, January, February, March. Now we're in April. Hopefully we will get the casualty open by April, and that will help alleviate some stress. And I mean some stress on the other hospitals. But we're far from how we are supposed to be treating the patients of Gauteng. And honestly, the Premier, the MEC, the Minister of Health, I think if you've said something, you're not putting your words into action, and I would give you 0 out of 10.
Professor, do you have contractors on site at the moment? And if you do you have conversations with them?
So we have contractors on site, and we have management that deals with contractors. And these current contractors are from Solidarity, which is a private funded organization and an NGO that's assisting. I think the government-funded Development Bank of South Africa and the Department of Health, their contractors will probably be starting later on in the year. I haven't even touched on the morale of finding parking. Simple thing as that. You come to work frustrated because you've waited an hour and a half and you're parking your car on the street. Cars are getting broken into, cars are getting stolen, and that's, if you're lucky, you get a parking. So, and hopefully the commitment from the Department of Health and whoever is doing construction is maybe by May we shall start parking a new parking ramp so we can get 300 bays. But 1 year later, you go, is this fair? We're still talking about contractors getting on site. That's for me absolutely shocking. We're still talking about people coming on site 1 year later. We've lost so many patients in the system from COVID. Even the district healthcare systems are suffering. And the management and leadership needs a complete overhaul in Gauteng. That's my personal opinion, and I'm happy to put my neck out there and fire me if I'm wrong.
Well, Professor, we certainly hope that you don't get fired. I mean, you are doing an incredible job. Now, off air, we did talk about you going to KZN in the next day or so to assist, certainly with the challenges that the people of KZN are facing following those incredible floods that we've seen in the last few days. Talk to us about your opinion on the capacity of KZN to deal with the challenges from a medical perspective that they're facing?
I think the entire country has to rally behind KZN. Can you imagine a 4-month-old baby floating in water? And if that doesn't soften the heart of any single human being in South Africa, then we have failed as a country. The entire government needs to be mobilized. How we did a COVID mobilization and we put everyone under lockdown, let's put our country into lockdown to fix and help these people in KZN. And the sad part about KZN and in the rest of the country, who are the people that suffer the most? I'm sorry, it's the poorest of the poor suffer the most. Who's staying on riverbanks? It's the poorest of the poor. The entire country, let's rally and go and support these people with whatever. It's not just money. It's time and energy we need to give to these people to help them get back on their feet.
Professor, one of the things that, I don't know if it baffles me, but is how people are going to deal with the mental trauma that has been caused. I mean, you talk about seeing a little baby floating in the water. I mean, I have to be honest with you that yesterday's bulletin was extremely heavy for me, as some of our reporters out in KZN giving us bite by bite of what was happening there, and speaking to individuals that have lost 3 or 4 family members, some as many as 10. How do you deal with that, or how do you recover from that trauma?
For me, I think going into the system, touching human beings, going to those people that have lost loved ones, and just saying hello, putting your hand on them, making physical contact. COVID has taken away our humanity and our ability to engage with people as human beings. We need to go there and give physical support. It's not just about money. It's about giving someone a physical shoulder to cry on. We need to start hugging people. We need to start smiling at people. Just a little smile. Walking in a road and saying hello to a stranger. Hello, how are you today? Hope you have a great day. Simple things like that there. I think we can bring back any community. And if we are soft, and there's many slogans going around, I like this one. Be kind. It's a simple thing. Let's just be kind to human beings. We are all of one community in this world. And what I see with the help going to KZN, this is nothing about foreigner or religion or color. This is about who we are. We are human beings. Let's go and touch our human beings and make a difference. You can't go there personally. Give money, give resources, even 1 cent. And 50 million giving 1 cent each, we will make a dent to help all our individuals in this country. Let's work together to make ourselves better in this world.
Professor Adam Mahomed is head of internal medicine at the Maxeke Hospital. And we were talking about the state of the hospital 12 months on. And many parts of the hospital are still in a dilapidated state. And also speaking about him going out to KZN and trying to rally the troops, so to speak, about how all South Africans should really be focused on helping South Africa.